Hello and welcome. My name is Chris Rowena. I'm the lead communications analyst with Health Workforce Development here at HCAI. We're so glad you could join us today for the Peer Personnel Training and Placement Program webinar. We're excited to share more about this important opportunity and walk you through the details of the program. Here's a quick look at today's agenda. Start off with housekeeping and introduction, followed by a welcome and overview. We will go into the program details for the Peer Personnel Program, followed by a time of question and answer, and then we will end today with closing remarks. Before we get started, here is housekeeping information we'd like you to know. This webinar is hosted in Zoom. If you're not familiar with the platform, you can find the camera, the microphone, the chat, and the view controls in the menu bar, either at the top or the bottom of your screen, depending on how you have your screen set up. We will be using the Q&A for questions today. So we'll have that available. It says mic and chat, but you actually click on more and you will see Q&A. And I see we've already got some questions in there. So thank you for getting that started. And this webinar is being recorded and will be available within 7 to 10 business days. And now it is my pleasure to introduce Clinton Ramstead, Program Manager for the Peer Personnel Training and Placement Program here at Health Workforce Development, to share some opening remarks. Clinton.
Thank you so much, Chris. And hi, everybody. Thank you so much for taking the time to spend some time with us and talk so we could talk about peer. My name is Clinton Ramstead. I am a program manager here at HCAI. I'm sure many of you here today are familiar with HCAI's programs, but for our new participants, I'm going to offer a brief overview of HCAI's work, starting with our missions and vision statement. Next slide. There we go. Our vision statement is a healthier California where all receive equitable, affordable, and quality health care. Our mission statement is HCAI expands equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Next slide, please. These right here are our program areas that we concentrate on: facilities, financing, workforce, data, and affordability. I'll let everybody look at this for a few seconds before we change to the next slide. Okay. Next slide, please. At the bottom of the page, you will see that HCAI focuses on 4 key program areas: behavioral health, nursing, primary care, and oral health. HCAI tries to focus on medically underserved areas, which can also include Medi-Cal populations and shortages where language is not always available. We hope to expand on our workforce pipeline and education capacity and educational expansion to see if we can help providers with retention. Let's see here. Well, that just about sums it up, the work that HCAI does. We'll get into the meat of this, the Peer program here. Mo, would you like to take over and assist?
Yes, thank you, Clinton. First of all, I wanted to say good afternoon to everybody and thank you for joining us today. Some of you already may be familiar with me throughout our email conversations and questions that you have asked before. I'm the program officer. My name is Mo Arshadi, and this is a brief overview of the HCAI Peer Personnel Program here that we have. It funds public, private, and nonprofit organizations, including faith-based and community-based organizations, for training and support that facilitate the training and placement of peer personnel. Peer personnel are individuals with lived experience as a mental behavioral health services consumer, could be a family member and or caregiver placed in a designated peer position. Now, applicants must provide training to peer personnel that meets the 80-hour training requirements under the DHCS Medi-Cal Peer Support Specialist Certification Program. There is no service obligation with this program, meaning that the the peer people that you guys train and place, they don't necessarily have to remain with the program they sign up. They can later on move on working with other organizations. Next slide, please. And here we have some key dates for this cycle and the funds that are available for this cycle. So the application cycle opens up in January 9, 2026, which already has opened, of course, and will run through March 6, 2026. The grant period, which is the grant period itself, will run from July 1st, 2026 through June 30th of 2026. This hasn't changed, which is a 2-year program. So we kept that allocation again. And the available funds for this year are $6 million. Next slide, please. And here are the program components. They haven't changed from previous years that you're familiar with. So these are the main components: the recruitment and outreach, which target individuals with lived experience, reflecting community cultural and language needs. The next component is career counseling, individualized career plans, and workforce advancement guidance. And of course, training, the 80-hour DHCS Medi-Cal Peer Support Specialist Certification aligned training. And then we have the placement and support, of course, employment or volunteer placement with 6 months of post-placement support. Next slide, please. And here are some training and certification requirements. So the participants must complete the DHCS approved 80-hour peer support specialist training. Training must be delivered by a DHCS recognized provider or approved partner. The certifications issued by Cal Mesa or the California Mental Health Services Authority after training completion and exam passage. Certification number must be reported once available. If anybody has any questions about that, we try to include a link in our grant guide this year that will show where you can verify the certification numbers once they are available. So there's no requirement for reporting those numbers until they are available to you as a organization. Next slide, please. Here are some placement and performance expectations. The placement includes paid or unpaid peer personnel positions. The program must place at least 80% of participants to receive full placement funding. Employers are responsible for identifying and funding peer positions. Placement success is a core performance metric. So as you already know, placement is the most important aspect of this program. We would like to see, obviously, full placement. It doesn't happen every year, but that's our goal for this program and our mission for this program. Thank you. Next slide, please. This is something I wanted to point out. This is the award amount and funding request considerations, because a lot of organizations sometimes get confused if they should apply for the whole $1 million, because that's the maximum amount. And we wanted to put that out there as a statement. So the maximum award per organization, it is $1 million. You are not, however, required to request the full amount. Applicants should request only funding necessary to implement their proposed program. Now, the trouble was that we see a lot of organizations that apply for the whole $1 million, and unfortunately, they're not able to expend all the funds they apply for. So it's a good suggestion to only apply for the amount that is necessary to implement the program. Thank you. Next slide, please. And here are the allowable budget categories. This also has not changed from previous years. Now, there's 2 main categories, which are the direct costs and the indirect costs. Up to the 7th bullet, these are the direct costs. And then, of course, we have the indirect costs, which are the miscellaneous charges. But for recruitment and outreach, it should be 5% or less of the direct costs you're requesting. The career counseling should be 20% or less. The training should be 40% or less. And the financial assistance should be 10% or less. For placement, it's 35% or more of the direct costs being requested. The support is 20% or less. And the evaluation for your program is 5% or less. And then the remaining 10% of the direct cost should be for the indirect costs depending on your choice. Intercost is not something mandatory, but a lot of programs do take that into consideration. And then the total would be basically what you're they're requesting from us. Thank you. Next slide, please. And finally, there are some grant application resources here. The main ones are obviously the Peer Personal Grant Guide link here. You probably want to review that. There are some changes that we have made for this year. So my definite advice is to review that before you start applying for your application. And then the Technical Assistance Guide, as every year, that also has changed a little bit. Will guide you through the application process. And then we have the online application portal at the bottom there on the left-hand corner, which will take you to where you can apply. And then the behavioral health programs, our email is there for our general inbox. If you have any questions that we may fail to answer here, you can always email us and we would be more than happy to answer your questions. Next slide, please. And now I would like to hand it over to Chris Reyna, our lead communications analyst, for any questions or answers you might have.
Thank you so much, Mo, and thank you everyone for joining us today to learn more about the peer personnel training and placement program. Getting tongue-tied today. We're going to enter our Q&A session right now, and as some of you have already been doing, you can do that by using the Q&A feature, which click on the More tab if you don't see it in your toolbar, and you will see it will say Q&A. You can enter your questions there. You can also upvote if you see a question that somebody asked that you also have the same question. You can click the little thumb, and that helps us know that a lot of people have that same question. This allows us to capture all the questions. Even if we run out of time today, please enter all your questions and we'll be able to capture everything that is important to you, and that will help us stay informed of what is going to serve everybody the best as we execute this next grant cycle. So as we go into this, I'm going to just start going through our questions that have been submitted. And Mo and Clinton will be available to answer those questions. And so I'm going to start with this first question. Will you please clarify that there are only 2 narrative sections allowing 1,000 characters each, and that there are no other ways to further expand upon our narrative with the application, for example, uploading a Word document with more detail? Looks like we'll be evaluated in several areas which may require more detail than the application allows for.
Yes, I can take that question over. Yeah, so the limit is 1,000 characters. That is a good question. We have not implemented to upload any kind of documents, but we can take that into consideration for future cycles. But yeah, so right now it's however limited to 1,000 characters.
All right, thank you for that question. Next one, I have an AS degree and I'm pursuing the peer support specialist pathway. Does having an associate's degree qualify me for any specific career ladder or advanced training stipends within the HCAI scholarship program?
I would want to refer to Clinton for the answer to that question. I don't think it directly relates to the peer program.
Yeah, no, I'd be happy to help with that, Mo. And so the purpose of this program is for the organizations that are applying for the peer program, that they can provide the training opportunities for their own peer support specialists. If you happen to be interested as an individual in pursuing a peer support specialist certification, what I could recommend is you can either work with or contact one of these agencies that we're trying to work, that our cycle is open for right now. Or you can also apply. We have a BH Connect program right now. If you go to the hci.ca.gov website, we have opportunities and more specifically for the BH Connect, that you may be eligible for one of those programs if you apply for it. We do have a cycle that's going to opening up for peer support specialists. I believe it's going to open in March. But if you're an individual who's interested in this and seeing if you can get some funding for that, I would highly recommend you go and check our website at hci.ca.gov and look for the BH Connect funding opportunities. Thank you.
All right, and let's see here. I am going to post the link on that question here to the program that Clinton was talking about, the BH Connect Community-Based Provider Training Program. And so everybody can see that link in the answered questions section there. So thank you for that great question. All right, next one is, can you please reconfirm the grant period again?
Yes, so that is also in the grant guide if you ever forget that, but the application opened, it was January 9, 2026 at 3 p.m. and the application close date would be March 6, 2026 at 3 p.m. The grant period itself, I believe it runs from June of this year, beginning of June of this year, and it will run through, uh, so it's 2-year program, so it will run through June 30th of 2028.
All right, thank you for that, Mo. Next one, does the scholarship cover just the 80-hour training course, or does it also include the Cal Mesa State certification exam fee and the background check fees?
Hey, this is Clinton again. This right here is not a scholarship program. This is a grant opportunity for an organization. And so we're awarding organizations that train their own peer participants. So if you're interested in a scholarship program, again, I would refer you to the hci.ca.gov website, where you can look at the BH Connect training opportunities that are available, or the funding opportunities that are available there. This cycle right here is for organizations seeking to make a grant with HCAI.
All right. Just a note on a couple people having trouble staying in the webinar. Daniel, I did message you with that. If you can let me know if there's a specific error code or message that you're getting, something that would help me understand where that problem might be coming from, that would be helpful for us to diagnose what's going on there. If you do continue to have problems, we do apologize for that. But we are recording this and it will be available on our webpage as well. Feel free to enter any of your questions into here that you have, and we will capture those. All right. Are there specific training vendors or workforce education and training programs you recommend specifically for residents of Stanislaus County?
Uh, we can't really recommend anybody. I mean, the organizations we usually work for are, I mean, that I come in contact with are usually in California. I don't have any specific ones right now for that county.
Elizabeth asks, what are some examples that you will consider the financial assistance?
Yeah, so financial assistance can include anything like tuition, enrollment fees, certification exam fees, um, peer mentor stipends, pay for peers while they're in training and placement. Those are kind of the examples of financial assistance. They can also include textbooks, training manuals, laptops, anything like that too. Those are all, if those are all assistance you're giving to your peers to basically pass the program.
All right. Next one, for this grant, can the definition of peers include family members with lived experience supporting a loved one with a mental health condition?
Absolutely, yes.
All right. This next question that's in the chat is again asking about scholarship cycles. And this isn't a scholarship right now. This is a grant. Go ahead and look in the answered sections for information on the current scholarship that we have open. You'll see the BH Connect link in there for that scholarship. And that will be coming open in the next couple months. Next question after that is will we be able to get a copy of the deck? We will be posting the recording and the deck on our webpage within 7 to 10 business days. We do need to make sure that they have been made ADA accessible before we can post them online. And so we will have those up as soon as we can within that time frame. Next question. In light of recent uncertainty around federal behavioral health funding, is there any indication that this grant's funding structure could be influenced by future federal directives?
I would refer to Clinton for the answer to that question.
Hi, folks. This is a state-funded program, and so at the moment, okay, we're not subject to any of the work or activity of the federal government. So this program is solely funded with state funds right now, and so at the moment, our funding is secure, and our program is continuing as it has before.
Thank you, Clinton. Next question, are there preferred geographies? If so, please expand.
They are preferred geographies. We mostly are trying to get people or organization to train their peers and their peer supporters in rural areas. I can't pinpoint any of them right now, but yes. So to those areas that are mostly in need, like the rural areas and the underserved areas.
Tisha asks, so we apply for grant funding and then we find and get employees trained for the program.
I'm sorry, I didn't understand the question.
I was just trying to understand how the program works. Yes, so we apply for grant funding and then we find and get employees trained for the program.
Yes, in order to apply for the program, though, you have to be on the California Mental Health Services Authority's list of approved training providers.
All right, thank you. Carla, thanks for putting a little helpful answer to Fabio's question there. We appreciate the collaboration on that. Brandon asks, for applicants who are not DHCS approved training providers, can you confirm whether serving as the prime applicant while subcontracting with the DHCS recognized training provider is acceptable and scored equivalently?
That probably is a question you should ask Cal Mesa, but as far as I know, right now it's not the subcontracting ones. It's the ones that are actually listed there as the official training providers that we're able to basically work with.
Just to expand on that, we are subject to Cal MHSA's approval there. So if you could get on their list, that makes you eligible. But if they do not approve you, then you would not be eligible to apply for this opportunity because there's a conflict of eligibility. So Cal MHSA.
All right, thank you. Vicky asks, the application states on page 3 under 1 recruitment and outreach that recruitment efforts may target individuals with lived experience in high schools, adult education programs, regional occupation programs, community colleges, and those already working and or volunteering in a behavioral health program. Is recruitment limited to this group?
It is limited to those groups, yes.
All right, Vicky, thank you for that question. All right, next one. Can you provide an example of what a successful program proposal from prior years has looked like? Like, what are the basic parameters of a successful peer personal training program for a local CBO?
I'm sorry, Chris, could you repeat the question again?
Of course. Can you provide an example of what a successful program proposal from prior years has looked like? For instance, what are the basic parameters of a successful peer personnel training program for a local CBO?
So when that comes into mind, we look at the scoring criteria inside the grant guide. So if they wanted to know what's a successful program, my advice is to look at the grant guide, read it thoroughly, and then pay close attention to this scoring section, because that's where it boils down to. Like that's what we have our major focus on.
All right, thank you. Let's see here. I'm a little overwhelmed and totally new here. Can you please clarify what the scholarship situation is for an MSW student? So again, for this program, this is not a scholarship. This is an organizational grant, and we would direct you to our webpage for our scholarships. In particular, if you look under the answered questions, look for that question from Fabio at 3:09 p.m. has the link to the BH Connect programs. You'll want to look there. Clinton, anything you want to add to that?
No, that's it. If you're looking for an opportunity, HCAI wants to help you. So, I mean, please keep an eye on what we're doing. It's just in this particular case today, this webinar is chiefly focused on organizations applying to provide training for peer participants themselves.
Yeah, we have our BH Connect scholarship program would probably be the one that you would want to look into in that situation. All right, Vicky asks, how does credit for placement work if participants are already working or volunteering in the public mental health system or community-based organization?
I'm sorry, that was kind of fast. Again,
Apologize. How does credit for placement work if participants are already working or volunteering in the public mental health system or a community-based organization?
Well, once again, this is the purpose of this grant opportunity is for organizations to recruit, train, place, and then hopefully, if they go the extra mile, support peer participants. And so that's the purpose, is to help find people, train them, and then put them into service as a peer participant. If you're already working, I mean, we're grateful for that. You're adding value to the state, but the purpose of this program is to get new people and train them, you know. So we do have opportunities at HCAI for you. And again, we'll refer you to the hci.ca.gov website. There are opportunities for you, and you should, you know, keep an eye on that. But this particular opportunity is for organizations trying to find new people and put new people out there.
All right, thank you. I think the next one again is looking at scholarships. So we're going to move past that one. Could you clarify if IHSS providers via CDSS are considered placed by HCAI standards? Several applicants in the past have considered caregiver roles that incorporate peer support.
so short answer is no. IHSS providers via CDSS are not considered placed under HCAI's peer personal program standards. So um, why IHSS doesn't qualify is because their providers are administered through the California Department of Social Services. It's not part of the peer program.
All right. For the next one, for an email address for discuss needs for funding MSW, what would be a good email address to direct people to workforce or BH programs?
I would say probably the BH programs at hci.ca.gov.
All right. Programs at hk.ca.gov. There
Yeah,
we
so
go.
it's the BH programs, plural. Yep.
Make sure I got that right in there. Yep, BH programs. There we go. All right, so there's that email address for you. All right, Carla, Carla asks, can you cover some of the biggest and most common mistakes applicants make on their applications, especially with regard to scoring that prevents them from being successful? Great question, Carla.
Um, Mistakes that applicants make. Sometimes there's times that we see several people from the organization that are applying for the grant program, and they leave the application halfway through. Those will obviously fall out. And then most of them don't really. It just depends on our funding, like how much funding we have available. from previous years, we have noticed that applicants typically score high on the application. But if there's any question, because the application is pretty straightforward in terms of because first of all, we have step-by-step application guidance inside the technical assistance guide if you're already familiar with that. If not, you can familiarize yourself on that with that on our website, and then the grant guide itself. But if you have any questions, I think somebody else had asked if they can put my email address in here. By all means, Chris, you can put my email address in there. And if you have any questions regarding the application, I can't help you with the details of the application, tell you what to put on there. But if you have any questions on the application itself, I can definitely answer those for you.
All right, sounds good. I did want to point folks to something that we do have available. If you click on the More tab, there's a option called Resources, and you can see that we have both the links to the Peer Personnel webpage and the application page there. And we also have the grant guide and the technical assistance guide that Mo just referenced. So if you haven't seen those, you can download all of those right here in Zoom. All right. Uh, Next question. The grant guide says applicants must be a DHCS recognized training provider that can meet the 80-hour Medi-Cal peer support specialist certification training requirements or must be contracted with a DHCS recognized training provider. So it sounds like we can contract with an approved provider. Can you speak about any contract structure requirements? Is an MOU sufficient?
I would like to refer to Clinton for that question. I'm not 100% confident that I have the answer for that.
Just for the ease of understanding, we that work needs to be done and inspected and reviewed by Cal MHSA. So if you can get on their list, okay, they're the ones who make that determination. If you get on their list, then by our standards, you're okay. But that's how you do it. So I would refer you to the Cal MHSA website. If you have questions about that. And we do have a link in our grant guide to their website if you're at the beginning of this process and trying to get qualified. But it's worthwhile because we rely on them to make the determination, and then if they approve, then you're okay for our program.
All right, thank you. Carla asks, what are you looking for in the partnership section? Any additional guidance would be appreciated here.
That when you say participation section, is that part of the application you're talking about? I'm not sure.
Partnership section.
Yeah, that's what I mean. Is that something pulled from the grant guide? Is that part of our application?
Carla says yes, part of the application.
I'm not sure if I know the answer to that.
Yeah, these are the sites that an organization will partner with, and so and that's also part of the approval process for Cal MHSA. They look at your organization and they look at your approved site. So a parent organization can work with other contracting agencies, and share, I guess, their authority, their licensing with that other agency. And so that is what is meant by the partnership. But it's up to Cal MHSA to make that determination if an organization is eligible, and also their partnering agency. I hope that helps.
All right, thank you. Elizabeth asks, when applying for the grant, if the organization states that they want to help out 70 participants to get their peer certification, will that be the number we have to accomplish within the 2 years or 1 year?
Good question. Yeah, that's achieved over the entire grant period. So I mean, they might end up getting all their 70 participants trained in place within the first year, but most of the time it's not the case. But yeah, it's meant to say that it's over the entire grant period, so typically up to 2 years.
All right, great question. Thank you. How do you handle multiple applications per organization?
Uh, I kind of weed those out. So basically, we like to see the director of the organization or uh, the designee by the director to submit the application, start filling out and submitting the application. And if we see one is submitted through the director, then we unfortunately go ahead and ignore the other ones that are being or using the same organization name to fill out another grant application. But we mostly keep in contact with the directors to determine which is the correct application. But we strongly advise if you have already start one, at least let your office or your staff know so not somebody else working under the same program applies again and we have like 3 or 4 duplicates or 2 or 3 duplicates, which also confuses us too.
Well, just to add to that, we also, as part of the requirement for making an agreement with HCAI, we do take an organization's tax ID, and so their unique tax ID or FEIN. And so if we see 2 of them, then that kind of raises a flag and we ask more questions. Now, it is possible though that you could be sponsored under a, would you talk about those partnerships earlier? You could be sponsored under a partnering agency. But you will have a different tax ID if that's the case. You'll just need to reference the agency that is assisting you or giving you the affording you the authority to apply.
All right, thank you. Okay, let's see. Jason asks, can an approved Cal Mesa trainer partner with another nonprofit to cover a different geographic rural region?
Yeah, as long as they're Cal MHSA approved, I don't see why not. Um, we're looking for, a broader coverage of California, and so, especially if you have the opportunity to serve in rural areas and underserved areas, that's in line with what our mission is as HCAI.
All right. And then Jason also asks, is a memorandum of understanding between the partner organizations sufficient for HCAI to approve the partnership?
I think if they're talking about training sites, um, in most cases, a signed memorandum is between the partner organization is sufficient for each guy to approve. Clinton can confirm that again, but approve the partnership. But if they're talking about applying as an organization for the grant, again, that would we would go back to the same statement that they have to be on the Cal Mesa's website as an official DHCS trainer.
All right. Thank you for that. Next question. People who are placed upon recruitment but have not received 80-hour MPSS training or state certification, would they not be eligible for training under this grant agreement? What about individuals not trained or certified, either who seek employment outside of their job opportunity, or excuse me, outside of their current employer or seek a second job or volunteer opportunity outside of work?
If I understood the question correctly, the answer would be that they should um, they should seek out those people who are applying at the beginning steps. Like for example, they're recruiting those people, then they're career counseling them, then they're training them. Not somebody who's like for instance in the middle of training and then they decide to join your program to be able to be placed because maybe they ran out of funds in the middle of that process. So they should all be like for example, this cycle for cycle 2026, they should all be starting fresh from recruitment to career counseling. So taking all those categories into consideration.
All right, thank you, Mo. Let's see. Holly asks, can a training provider be a prime applicant slash training provider and a training site under another organization prime applicant?
Clinton, you wanted to answer that question? I'm a little
It's
confused
the
by.
same question related to partnering agencies here, still needs to be Cal MHSA approved. If you could be a parent organization and then apply as another organization, but the relationship needs to be identified and recognized by Cal MHSA. If it is, we're good to go. If it's not, then we're beholden to that requirement. So that would make you ineligible on our end.
All right, thank you. Next question we have, will HCAI allow us to upload MOUs this year? I recall that uploads to our applications were not enabled last year except for a budget detail, if I remember correctly.
I do not believe we have a section for because the only part of the application that actually no, I don't think for peer we do have the only part that is manually entered is the budget tables. We don't have anything for uploading MOUs. Is that because they are trying to become a certified trainer or trying to apply for the program? I'm not sure I'm understanding that correctly.
I think we're still talking about partnerships.
Yeah, so I think so. It's the same answer. It's that they have to be a trainer. There's not a way around it right now, at least. They have to be a certified trainer under the CalMesa. I would basically rely on the same answer again.
And then specifically, this question is asking, earlier we indicated that they needed to submit an MOU to demonstrate that
As a training
partnership.
site, yes.
Yes. So they're asking, is there a place on the application to submit that MOU, or if not, how do they get it to us?
No, there's not a place for MOUs. There is a section on the application that will ask about where your training sites are going to be, and I think they can list them there. Like the main organization who's applying for the grant has to do that. So if you asking this question as being a partner with that organization, with that main organization, you probably want to notify them to list you as a training provider. Um, if I'm understanding it correctly, yeah.
No, just this is Clint again. Just as a refresher, is still subject to Cal MHSA approval. So, if you're working on an MOU, it'll need to be probably sent to or issued to Cal MHSA. We don't do that on our end. We work off of their approval. And so, and that same list that's on the website is the same one that we use to identify if a organization or their partners are eligible.
All right. So on that same topic, are MOUs or other evidence of contract agreements required from partner agencies listed in the application, required at the time of application, and by partner agencies, they mean placement sites.
Well,
What
again, this is subject to the Cal MHSA approval, and there have been a couple circumstances where an applicant is working on something. Maybe they've been working on it for a while, and Cal MHSA will tell us, "Hey, they're not on the list yet, but we're going to update it in a couple days, and then they'll be there." And as long as it's right before we make our award recommendations, it'll probably be okay, pending their approval. Okay. It's not up to us to decide, but Cal MHSA. But if they allow it, then it'll be okay.
All right. And then for clarification on that, or agency is an approved trainer is the other clarification on that question. Our agency. Our agency is an approved trainer. So they are approved by CalMesa.
Oh, if that's the case, then by all means apply, If you're on the list, it's no problem. We'll double check that by the time we get to award recommendations. If we see you there, no problem.
So again, I think the question that they're looking for is how do they submit the MOU portion of to demonstrate their partnership in the application process. I think that's what
No,
is
that
being
that
asked.
that'll be between them and Cal Mesa. They have to prove that to Cal Mesa, and then Cal Mesa will include them as a partner. It'll be on their list they'll be listed as a partner on their website.
All right. And next question, Jason asks, please clarify, I thought you said an organization that was not approved trainer could apply in partnership with approved training organization. Is that the case? So I think we're still trying to understand the nature of partnerships with this.
Yeah, so sorry if I confused you. So if you're in partnership with them and not listed on the CalMesa's website, no, you may not apply until CalMesa has approved that, just like Clinton was saying. But and I think there's a link in the slides too that will help you take you to that CalMesa website, and it has a list of providers there. I think right now there are 27 or 28 approved. I might be not exactly accurate with the number, but yeah, if you're among those organizations, then you're okay to apply. If not, then that language has to come from CalMesa, or that approval has to come from CalMesa.
All right. I'm gonna give about 30 seconds for any other questions that we have out there. We did get through all of the questions that were submitted, but really appreciate everybody's participation with us today. It's one of the reasons why we do these webinars, is to give you a chance to ask these questions, and it helps us make sure that every time we're getting the right information out and the most useful information for you all. Let's see here. Did want to call out again, if you do have questions that come up after the webinar, please email us at bhprograms@hci.ca.gov, and we'll be able to help you out there. I did have one last question from Carla here. So any partner we name must be on the CalMesa website, whether they are a training partner or otherwise. Is that correct?
Correct, yes.
Okay. Fantastic. Thank you. All right. And we'll take this as our last question today. We're getting towards the end of our webinar. Again, for clarification, for example, if we were proposing to provide a placement to 50 participants and we have to demonstrate organizations that have openings for each of these participants, do we have to have agreements with the placement agencies at the time of application? Does that make sense?
I would assume so. Those are the partners you're working with, so there should already be an agreement in place. And there's a section on the application that you will list those organizations that you're partnering with. So we'll be able to review that again.
If you happen to be talking about training sites too, we do ask for that upfront in the application process. We want to know where the sites are that people will be trained at. So that's built into the application. So you will need that information as part of the award consideration. If you're talking about training sites.
All right, thank you so much. And again, thank you for all your thoughtful questions and the active participation today during that Q&A session. Once again, if you did not get your questions answered or think of other questions in the future during the open period of this grant, please reach out at bhprograms@hci.ca.gov. And now I'm going to hand it back to Clinton for some closing thoughts today.
Hi, folks. Thank you again so much for joining us. I imagine a few of you have some questions that we didn't have time to get to, and if we missed your question, we're happy to help you out. Mo here is my program officer, and he's a great guy, friendly guy, and he's very quick about helping people. Our email address is bhprograms@hci.ca.gov, and we're happy to help you out. We like this program, and we like doing this work, and we're friendly people. So please, you're welcome to send us an email, and we'll be happy to help you out. Thank you so much for joining us today, and we look forward to hearing from you. Again, my name is Clinton Rapsett, and thank you.
Thank you.
All right. Thank you, Clinton. Just a couple last things before we end today. Thank you again for joining us to learn more about the Peer Personnel Training and Placement Program. We are proud to offer this opportunity as a part of our broader efforts to strengthen California's behavioral health workforce. Before we wrap up today, we invite you to explore the many resources available on our website to support your journey through the health workforce. And we can go to that next slide there. Thank you. We also would love for you to take a look at all of our social media resources. You can find us on social media at all of these places, and we would love for you to hashtag any of your activities with that and let us know the great work that you're doing for the state of California's behavioral health workforce. As a reminder, this program does close on March 6th at 3 p.m. So make sure you get your applications in. Want to also mention that on the next page, sign up for our newsletter if you haven't done so. Go to hci.ca.gov mailing list and you will be able to sign up for our health workforce newsletter that we send out monthly. Check on any of the options within the health workforce section on that sign up form, and you will be automatically subscribed to that newsletter to stay up to date on all of the things health workforce that HCAI is doing. You can always contact us at 916-326-3700 or healthworkforce@hci.ca.gov, or for this program specific, BH programs at hci.ca.gov. We thank you today for attending. We appreciate your time and interest, and please stay tuned for more information. We'll have this webinar posted on our webpage within 7 to 10 business days. Thank you and have a wonderful day.